Okay, so welcome back from the break. My name is David Haas. I'm an OBGYN at Indiana University, and we're going to continue our conversation about data this afternoon, but a little bit of a shift from real-world evidence, which we've heard a lot about, and we're going to shift to data that was actually specifically collected for research and how NICHD is trying to help us with repositories and sharing of data and specimens. So we're going to talk about NICHD data sharing and the DASH system. And we've got three panelists who are going to talk to us. Two of them are actually online and one is here in person. And each will have 10 to 15 minutes to kind of talk about their aspects of this issue. And we put together a really cool panel of people to really help you understand and help us experience what DASH is like, so you can understand a little bit better. We have someone who is in charge of DASH, someone who has placed data into DASH, and someone who has used data from DASH. So you'll get all of the perspectives, and then we can have discussions about how we can make things better, what works well, and what may need a little bit of improvement. So we're going to start off with Dr. Rebecca Rosen, who is the director of the Office of Data Science and Sharing at the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Dr. Rosen oversees and is the responsible use of data for DASH, and this is a centralized resource which she will help us with some level setting of understanding, because there are probably several of you in the audience who may not have even heard of DASH before. She has experience previously with National Institute of Mental Health, where she helped coordinate all of the mental health repository for human subjects data, making sure it's available for analysis, phenotype, imaging, all sorts of things. So she is really experienced with this kind of work, and I will let her take it away.
So, nobody's heard of DASH. David, I really did want to thank you for putting together an outstanding panel today. This is the exact type of perspective that I welcome. So let me make sure that you can see my slides. How are we?
You're good.
Oh, fantastic. Okay. So I wanted to start out today by reminding everybody of what I think we know very well from all of us being here for this event, is that NICHD is committed to promoting data sharing to accelerate scientific progress. This is exemplified in our 2020 NICHD strategic plan. We had a scientific stewardship goal 2 was facilitate data sharing and access to biospecimens. And one of the very first activities in implementing that strategic plan was establishing my office, the Office of Data Science and Sharing. And I have here the vision that David already shared. We do see a culture of responsible and innovative use of data and biospecimens that accelerates research and improves health for NICHD populations. We do already see some of that, and we're here to further encourage more. We do that in 2 ways. We advise on best practices in data management and sharing, and we are developing out a NICHD data ecosystem to support sharing and access to those data. I know that we've talked a lot about this policy here, but I'm going to bring it up again because number 1, it's a key driver for all of the work that we do in our office. And number 2, because of the beautiful way it lays up the value of a system like DASH. The policy has now been in effect for well over a year. It only has 2 requirements. The requirement is 1, that you plan for how your data and metadata will be managed and shared. Good data management is a core component of all good research. The sharing is a little bit different, but it is something that we are learning. It's a paradigm shift to think about where you're going to share at the outset. And we firmly believe that that informs good data management itself. And then once the program officer reviews and approves a data management and sharing plan, which does not go through peer review, the second requirement is that awardees are required to comply with their plan. It becomes a term and condition of your award. And there are guardrails. There are expectations that our Office of Science Policy laid out in the data management and sharing policy that are really wonderfully generalizable across NIH-funded research. You're expected to maximize sharing of data. You are expected to share in established data repositories. And timing here, you're expected to share either at the time of publication or the end of a performance period, whichever comes first. I want to highlight the definition of data sharing. It's the act of making scientific data available for use by others, for example, via an established repository. So you can't just say, well, somebody can find it, it's on my website. It has to be broadly findable. And so in addition to working with our staff and with Central NIH to advise on implementing the data management and sharing policy, we also oversee the established repository of DASH. It is our NICHD designated repository. It's where researchers can share de-identified data from clinical and population health studies relevant to our populations. It was established in 2015, and since then we've shared over 228 clinical studies. It's a controlled access repository. I'll provide some more details on that shortly. It's also a place where you can request biospecimens for a small number of studies that are available in DASH. And of course, it's all here with the purpose of accelerating research and improving health for our populations. You can see on the right the diversity of topics for which we have data and study data in DASH. And of course, with the data management and sharing policy, we expect that the number of studies will increase dramatically over the next few years. Now, DASH was established and operated out of our extramural program, and it's since moved over to my office. And so there is some change underway in terms of pivoting from the older model of data sharing, where you published your primary publication, and then you turn and share your clinical data with DASH. Now you have to start engaging early and often as part of the new data management and sharing policy. Of course, we have a number of other data repositories in what we call our NICHD data ecosystem. So the second arm of work in our office is to develop out a data ecosystem strategy to support our community's data science and sharing needs. Of course, DASH is a flagship system within our data ecosystem, but we have nearly 100 repositories where our researchers either share or access data for research use. So what we're doing now is we are assessing the data repositories, both NICHD funded and non-NICHD funded, to understand where our researchers can share data to meet long-term data sharing and security needs. And we are also trying to figure out how we can start building connections between our systems, both NICHD and NIH systems, to support responsible and innovative use of all of the shared data that is out there and that is coming. And the way that we are figuring out what those needs are from our communities is we are collecting and prioritizing user stories. And so I'm putting this out here because I hope this is an opportunity in this panel to collect and user stories from you all about DASH, both submitting to DASH and accessing data and biospecimens in DASH. So this is what a user story looks like. It's a truncated version of our story tracker, but it gets the point across. And like I said, this is how we document what our user communities want to do across the data ecosystem and why. And it helps us to figure out what we need to improve and enhance and what we need to connect. And we are in the process of posting these on a public GitHub repository as well. And so I'll walk through the format of a user story, because I hope that we can start eliciting them during this panel and throughout the workshop. And please do share them as you think of them. So the two examples here, as a program officer, I want to build a central place for my researchers to find and use global HIV health data. Why can't you do this today? Well, some of the data live in DASH and in import and in other places. Some are HIV, some are control. There's no one portal that makes all those data findable. And this is leading us to think through standing up public search APIs. We're looking at FHIR so that search portals can pick up and index DASH data, metadata automatically. A second user story here comes from an NICHD researcher. It's a perinatology researcher, wants to easily access and co-analyze new mom-to-be cohort data. Those data are in both DASH and the NHLBI-funded repository Biodata Catalyst. It's not possible today because the data from the two studies in this cohort are stored in the two repositories, and each they lack APIs and connectivity to cloud platforms to support interoperability. And this is part of a long-term activity that our office is engaged on with the NIH Office of Data Science Strategy to identify and implement standardized APIs, both authentication, authorization, and data exchange, to enable researchers to co-analyze data that live in the diversity of different NIH data repositories. So with that, I'll pivot to an overview of both submitting data to DASH and accessing data and biospecimens in DASH. Here are some high-level highlights from our DASH policy. I encourage you to have a look through the website. The link is at the bottom of the slide. In terms of submitting data, both data and biospecimen catalogs. So we catalog biospecimens that live in a separate NICHD funded biorepository. All data must be de-identified, and we follow the HIPAA Safe Harbor de-identification protocol. All submitters must provide an institutional certification, and this is an attestation that the data are appropriate to share in an established repository like DASH, according to the informed consent and any other rules. And the IRB or equivalent privacy board should verify that. And we also require that submitters send in a code book. It's a variable level metadata dictionary. For researchers looking to access data or biospecimen, they are asked to execute a data use agreement for data and a material transfer agreement for biospecimens. In the case where a study has consent from participants where IRB will be necessary for sharing or for accessing this data, we require that the submitter or the requester obtain IRB approval. Then all requests are routed to the DASH Data and Biospecimen Access Committee. And once a requester has secured authorization from that committee, they are required to adhere to the terms of the agreement or of either one of those agreements. And I encourage you to have a look at the agreements on our website. So I mentioned it is a bit of a paradigm shift for data submission to DASH with the new data management and sharing policy. You have to get involved early and often in submission. So we ask that you start submission right away. As soon as you get your award, start registering your study in DASH and prepare to have signed by your authorized organizational official the institutional certification that I mentioned by the end of year 1. And then start sending in your data dictionary, your code book by the end of year 2. That will allow you to format your data in a way that aligns with the data dictionary and that streamlines the validation process on the DASH side. We ask that you submit 4 to 6 months before you plan to publish, given that the policy expects that you're sharing no later than publication. We need time to curate, and getting the code book to us early helps streamline that curation process as well. Of course, we always recommend as a best practice to automate your own workflows to facilitate modifications as needed during the submission. We always suggest you use existing standards, and this is also mentioned as an expectation in the policy. Please look for suitable ontologies for your research, and then you can preserve those standards in the code book as you submit it to us. And so for de-identification, I mentioned already the HIPAA Safe Harbor. Another key message here, do not over-redact the data. The Safe Harbor requires you remove 18 identifiers and no more. And so it is not just removing variables because you think they may be sensitive. Variables should only be removed if they are covered in the HIPAA Safe Harbor. And that is in part because DASH is a controlled access repository. It has various controls for privacy protection in place. And I have a link at the end with all of the emails and other links for getting support from the DASH team. So the code book is a slightly updated code book, and what's updated is that it was required for submission to DASH now. And it is a critical aspect, of course, for standardizing, for streamlining submission. We are able to now run a QA check to ensure that your files match your data dictionary. It allows us to promote the use of existing standards. And you'll see here, here's a snapshot. This is an update to our code book that's about to go live any day now. And it allows you to, at a variable level, identify which standard you are referencing or where you got that variable from, and then actually include a link to a persistent identifier for that standard. And so not only does that help for submission, but it also helps for researchers who are accessing your data to ensure they are appropriately interpreting the data that you have collected using a given standard. And as you can imagine, this is really going to be a boon for interoperability amongst shared data sets, especially when we have networks of studies submitting and using common standards. And I have to put a plug in here for a new webpage from our office. In addition to guidance on data management and sharing policy implementation, we have a nice page here for data standards that we are regularly updating. So as I mentioned, DASH is a controlled access repository, and this is a term that NIH is standardizing in a way. So we have a guide notice that came out. It's a supplementary guide notice from, gosh, it's 2022 now. Came along with the data management and sharing policy with talking about protecting privacy when sharing human research participant data in light of the new policy. And it outlines the various controls that one should consider when sharing those data, and they generally fall under the rubric of a controlled access repository. And so it means that the system, the repository like DASH, should have processes for verifying who somebody is, and then also that they have an appropriate requested use for the data, and that any request be signed off on by an institutional official. And here is an overview of some of the high points from the data use agreement. It's a 3-year agreement that the requester and their authorized organizational representative will sign before receiving data. And then every 3 years, they're able to renew it if still needed. So I'm not going to walk through all of the terms of this just in the interest of time. And so my last slide here is a pitch for more user stories. You've heard this from me a few times, but I'll ask this again. Please do. These are real user stories, and it helps us to understand our opportunities for enhancement of the system. And so I really do appreciate your constructive feedback here today. And over to you. Thank you.
Thank you, Dr. Rosen. Our second panelist speaker is Dr. Elizabeth Payne from the Emmes Company. She's a biostatistician manager there, and she basically provides ongoing statistical support for a lot of different studies, but including relevant to this audience, the Best Pharmaceuticals for Children's Act, including assisting with all of their data and their protocol design. And one of the key things that she has particular expertise about is that she has personally deposited a lot of completed BPCA studies into DASH, having personally submitted over 20 BPCA studies into DASH. So I don't know if there's anybody who's put more into it than she has. So Dr. Payne, we'd love to hear from you.
All right, thank you very much for the introduction. And yes, I am a biostatistician manager at the Emmes Company, and I'm very happy to be here today to talk to you all about the study submissions that we have done to the NICHD DASH repository. Let me first start by sharing my screen, make sure you all can see. All right. All right, can you all see my screen?
No. Now we can.
Perfect. All right. All right, you can see?
Yes.
Excellent. Thank you for confirming. All right, so I'm going to be talking to you all today about the study submission process to the NICHD DASH repository that we have developed for the BPCA protocols. And please let me know if there are any issues with being able to see the screen as we go. So I thought I would start with just a very brief background on the BPCA project. So essentially, as you all know, therapeutic strategies may need to be different for pediatric populations compared to adults due to differences in growth, development, disease types, and pathophysiology. So the overall goal of the BPCA project is to address the lack of pediatric use information in drug labeling. And this is accomplished through efficacy, safety, and PK components in order to identify the optimal dosing strategy for a drug in a specific pediatric population. In other words, we are the dose busters, and we have made over 40 study submissions to DASH. and that's what we'll be talking about today. All right, so I have a couple of slides here about sort of preparing for the submission, getting everything ready. So once a BPCA study is completed and the associated final study report is submitted for regulatory review, the study is submitted to the NICHD repository. And just as a note, some of these steps I'm going to go through are going to sort of echo things from Dr. Rosen's presentation. So for each BPCA study, this includes a set of documentation, which is redacted. It's going to be your protocol, SAP, annotated CRFs, final clinical study report, PK report as applicable, proposed drug label changes. And then in addition to sort of the documentation set, there's also going to be raw SAS and CSV formatted data sets. This is going to be all of the study data, which is also redacted for inclusion in the submission, along with a DASH specified data dictionary / code book. Dr. Rosen talked a little bit about the code book. I'll talk a little bit about it as well as we go. But first, we have our sort of Emmes's rules for data redaction. This includes identifying variables like site, PAT ID, which are redacted. We do retain non-identifying, or recoded variables, which are utilized for linking records. And then all variables in each form are going to be reviewed for any HIPAA identifiers. This would be dates, lab names, reviewer names, and redacted as appropriate. And then also comment and text fields are redacted if an identifier appears in that field. We'll typically choose a key date. This is usually the enrollment date, which we'll then use as sort of the reference date for changing date variables and recalculating them to days from the key date, usually days from enrollment. And then lastly, but not least, SAS file names may be updated to meet length requirements for XPT file formatting if needed. And so background as promised to the codebook, the updated format and structure of this required codebook was implemented as a requirement by the DASH group. I believe this was around April 22. I don't know how well you all can see on the screen here, but essentially what this codebook is, as Dr. Rosen kind of talked about as well, is the data dictionary. It's an Excel formatted file that's going to have all of these columns to describe the data that you're submitting, so your data set name, the variable name, the variable label, and then descriptors like variable type, variable code list, unit, etc. So this is something that you'll be filling out for each study submission that you do. And then some information about the codebook. As you can see, it captures information about data sets, variables, coded values for all data submitted for a study. And the goal here is to increase the DASH quality assurance and data management flows, as well as the searchability of study data by investigators who are going through DASH. We here at Emmes updated our programming for this codebook for all DASH submissions. We utilize both system variables and manual components for each field across study forms. And we are currently looking into options for system updates in the future, in our future studies, so that we can be as consistent as possible with codebook specifications to sort of reduce some of the manual component in the future. And I included just some helpful links here. This is the codebook user guide, which is available on the DASH website for download. And there's also the institutional certification to submit study data to DASH will also need to be filled out and signed, and it's also available on the DASH website. So these should be easily accessible, I think, as PDFs on the website. All right, so once the redacted data sets, documents, and additional materials have been completed and compiled, then you're ready to actually begin your submission. And so I'm going to go through kind of just the steps for submission, and hopefully it will, you'll all be able to kind of follow along as if I was doing a submission. So you start by going to the DASH sign-in page here. You can see a link here. Then you're going to select Submit Study and enter initial information about your study, which will create an entry in your submission dashboard, and it'll have a text field there which you will fill out for your study. And so what I have here in the next slides is just kind of screenshots of like the submission as if you're performing it. So you can kind of see what I'm talking about. You can see we've got the submission name up at the top, the sort of preview submission pages. There's like 10 of them down the side here with different fields requested, showing different pieces of data, all describing the study. So we've got just kind of simple study registration information, basic study name, abbreviation, etc. And then you can see moving down the line, next contact information. Jump to my next slide. So contact information, that's going to be, you know, your submitter information. That's my information. I think typically when you sort of create your DASH profile, a lot of this will be something that you fill out, describing your job and your name and all those good things. And there are additional fields down below that I kind of couldn't capture everything in my screenshots here. So, but you can see this is the contact information. I think there'll be like PI information and maybe like DCC leadership information that you would also submit on this page. Next is policy compliance, and then there's going to be just questions about you know, is the study compliant with human subjects regulations? Hopefully that's going to be a yes. And so you kind of fill out some of those types of questions on policy compliance. All right, and now we're getting into some of the more like detailed information about the study. So this is going to be the study information tab. First, you're going to start with like a study description, and a lot of this text, I think, you know, typically at this point in the study, you know, you'll have your protocol, you'll have your clinical study report, you know, other documentation. So you can kind of put together a description of the study, you know, typically from kind of grabbing results from different places, what I do kind of in the protocol and the CSR. Study timeline, again, you know, enrollment, data collection dates, other information about the study will kind of go on this page. I think some of these pages tend to take a little longer to put together since you're sort of drafting text. The next one down the line, we've got study schema. This is going to be sort of your visit schedule. It's going to come from your protocol. So you'll have like what the baseline day 0 and then the information that's collected on at that time point. You'll sort of detail here in a study schema that you'll build. Study population is up next. You've got your total population and your description of the total population. And then here we've got this first one here, subjects by sex. So you'll identify the sex of your participants. Down the line, you'll have other demographics that you'll also include, like race, age group, etc. All right, this is biospecimen information. As a note, I personally have not yet done a biospecimen repository submission yet. I think that's something we're sort of looking into right now, is starting to come up for our studies, but this is not something I have done before. But there's a question here: were biospecimens collected for the study, and are they available for public sharing secondary use? So you would hit yes or no as applicable. And then data distribution, are you submitting to DASH all data collected based on your study protocol? Again, you fill out these fields as applicable depending on your study. Institutional certification, as I mentioned before, the institutional certification that you filled out, you'll go ahead and upload here, just right there. And then the last step before reviewing and submitting would be the data preparation tool piece. And so this is kind of the piece where you're actually downloading the DB data preparation tool to your workspace. And then it's essentially going to help you sort of catalog and upload your documents and data sets that you've prepared. So for me, I would download for Windows. Okay, and then I have some screenshots here showing sort of the steps for the data preparation tool. So this data preparation tool piece will come up, and then you have your dashboard here for this, and you're going to walk through a few additional steps using this tool to upload your study materials. And so this is going to want to add your collection, study submission. And let's see, so you can see here, we've got like 5 steps on the side. First, you're going to categorize your files. You're going to be entering a file path that's taking this tool to the set of documents and data sets that you're submitting. You'll just identify which ones are documents and which ones are data sets. And then the tool is going to create 2 templates for you to sort of build out. And I know this kind of looks like a lot of steps, but I think once you've done it once, it's much easier to sort of work through this process subsequent times. So you're going to get a data set template as well as a document template. And so for this page, the data set template shows this A column, each one of your data sets that you're submitting. Here's the CSV files that I would be submitting here. And then you'd be sort of filling in these columns. So you've got the title of the data set, the description, the type of data set format. Then I usually add the subject identifier variable as well. So you'd be filling that out for each row. And then sort of similarly, you're going to get the document template, and the column A again will show each of the documents that you're uploading. Like this first row is the SAP. And then you'd be describing the SAP with the title, the description, the document type, and then whether it's publicly available, which of course it will be. So, so that's kind of the process for filling out those 2 data set and document templates to catalog each of the files that you're uploading. And then once you've done that, then you will validate your templates, which is, I believe, just a click of the button, and then you'll go to your upload submission button here, which you'll click. And then that will take you essentially back to the NICHD dash submission page. You'll go back to that final review and submit row at the bottom of your dashboard, and you'll go ahead and submit. So it's a pretty nice nice process. It can be a little bit complicated in terms of there's a lot of different pieces, but I think once you've done it once, like I said, it gets a lot easier to sort of do it a second time. And again, the sort of automation of some of these processes is really helpful. So I have a few lessons learned slides to share with you all, some hopefully helpful tips and tricks. First, it is helpful to prepare standardized programming and rules and processes for redacting data sets and documentation, especially at multiple study submissions are a lot of different protocols. One other helpful tip is plan to include 7 to 8 keywords and topics to describe your study during the submission process. Note that keywords should already appear in the study title. I've tried to cheat that way before, and they don't like that. And it will probably take some time to draft some of the text field responses, like describing study population and results. So just keep in mind that some of these things do take a lot of time. And I do find that the DBT upload process works best if I use Google Chrome. I don't know if that'll be true for everybody, but that seems to be true for my workspace. The Dash codebook contains a variety of columns describing variables and data sets that are required and have a specified format. So it would be very helpful to keep this in mind during study design and system design, rather than trying to manually piece it together later on the back end, as I do. Examples include creating system-generated variable labels, which are clear, detailed and descriptive of the variable, don't include acronyms or abbreviations, but rather words which are spelled out, and check for typos. Not that we have those, but occasionally. And then similarly, system-generated code lists should be named so that they are clearly differentiable and provide context for the code. So your code list might be named something like specimen type instead of just a series of letters and numbers. Variables which don't provide valuable descriptive statistics, like subject ID, should be created and labeled as character variables and not numeric, which aids the ingestion process when uploading the data sets. My last slide here is that numeric variables must include a corresponding entry in the variable units column. There can't be any non-numeric values. Similarly, coded variables must include a corresponding code list containing all options present in data sets. Vice versa is also true. And code list names must have a corresponding entry in the code list tab of the code book. And the last note here is just that the DASH team will also review your submission, and they may ask for changes or corrections to your submission. And they have always been very, very kind, very nice to work with. So I do highly recommend reaching out to them with any questions. They're always very helpful in my experience. And that brings me to the end of my presentation. And so I'm happy to take any questions or comments or pass it back. And I'm also happy to take any questions if you all have them down the line. If you're doing a DASH submission, I'm happy to do so.
Thank you very much, Dr. Payne. And our final speaker this morning is Dr. Anna Palatnik. Dr. Palatnik is an MFM specialist and a clinician scientist at Medical College of Wisconsin. She has her research focused a lot on the prevention and treatment of gestational diabetes and gestational hypertension, and she has utilized the DASH system for multiple studies and multiple publications, both herself and with trainees. So, Dr. Palatnik.
Thank you. Good afternoon. Can you hear me okay? All right. I'm excited to be here.
Use the clicker, the big green button on top. Yep.
Great. Thank you. Okay, so I'm biased because I like DASH and NICHD, so it's going to be minimum negative feedback at the end, or I would say how to improve it, but it's mainly going to be why I enjoy using DASH and how I utilize this data set when I'm working with trainees, medical students, residents, and fellows. I will give you two examples of two different data sets that we used from DASH and NICHD. One is the CSL, Consortium of Safe Labor, and I'll just give you a brief update about this data set. So this is an information from electronic medical records of 228,000 deliveries in 19 US hospitals. And the primary CSL objectives were to explore the underlying causes of the high cesarean rate in the US, to describe contemporary labor progression at the national level, and determine when is the more appropriate time to perform a cesarean delivery in women with labor protraction and arrest. And I'm using women in this presentation because both of these studies used women back then, so I left it as was the original language of the studies. So what was the process of requesting the data? I submitted data requests online, and that included the project title, research plan, data and analysis plan, and everything was very easy. It was about a paragraph for each of these sections. Funding information, I had to identify authorized representative from our grants and contract office. It was an institutional business official, and then PI. And if you have any associates, if you're working with someone from the outside your institution, it was very straightforward. And once I filled everything in, the package was generated. It included two documents that I had to submit back, data and sign data request form and data user agreement form. So the PI had to sign it and the institutional business official had to sign it. And we submitted that in 2017. So back then I was just finished my fellowship. And that was a nice way for me to kind of boost my CV, to get papers out by using available data sets. So I was the PI on this paper, and my idea was outcomes of induction of labor versus expectant management among obese women at or after 39 weeks. It was at the time when the ARRIVE study was published, and there was evidence already that induction of labor has some favorable outcomes compared to expectant management in the general nulliparous patients. So I wanted to look at this question in patients who are obese. And so I submitted the request. It took about 2 to 3 months to get the data. And then it was accepted as an oral presentation to a very prestigious meeting in our field, the Society for Maternal Fetal Medicine, in 2018. And subsequently, we published this paper in a peer-reviewed journal. So it was good. I moved to do bigger studies, but I still used DASH to work with my fellows and residents. So for example, in 2019, I was mentoring a maternal fetal medicine fellow. We used also the CSL dataset for the research question of duration of labor induction in nulliparous women with hypertensive disorders of pregnancy and maternal and neonatal outcomes, with the hypothesis that the longer induction in patients that have hypertension in labor sometimes can lead to adverse pregnancy outcomes. This time, time to receive the data was 2 months. We went through the same process, submitted everything, including the signatures. And this paper was accepted as a poster presentation also in the 2020 meeting of Society for Maternal and Fetal Medicine. It was led by our second-year maternal and fetal medicine fellow, Dr. Zachary Coleman, who's attending now. And he published that also in a peer-review paper journal. And similarly, another research question using also CSL. So it was another submission also in 2020 to see if there are racial and ethnic disparities in maternal and neonatal outcomes among women with chronic hypertension. Similarly, Dr. Stearns was a resident back then. Now she's a fellow, and she submitted this as a resident, the request, and presented and published the first author paper. So this has been very successful for mentees. And I'll give you another example of using the nulliparous new mom-to-be study that Dr. Rosen, I think, mentioned in the first presentation. So this is a large data set that was studying mechanism of adverse pregnancy outcomes, such as preterm birth, preeclampsia, fetal growth restriction, among 8 clinical sites. They also had the sub-sites and a NICHD and a data center. And the women were enrolled in early pregnancy. They were followed through delivery, and they had robust data collection, 3 study visits during the pregnancy, and collection of interviews, questionnaires, clinical measurements, ultrasounds, even surveys on diet, physical activity, and a subset of them had survey on sleep and placental analytes, and so on. In total, there were over 10,000 women enrolled in the new mom-to-be study, and 9,289 of them agreed to release their data into shared databases maintained by NIH, so to DASH and NICHD. And I was mentoring Alison Wharton, who was a medical student. And usually what I do with medical students or residents, I tell them, go to DASH, create a profile, and download the code book, because then you can see what is available in the data set. At the same time, I teach them about what is preeclampsia, what is gestational diabetes, and we're trying to find papers that describes what are the gaps in knowledge or some hypothesis that needs to be tested. So this medical student, she went and downloaded the code book and came up by herself with this research question: effect of physical activity on placental analytes in nulliparous women. Specifically, we looked at SFLT, which is the antagonist to the vascular endothelial growth factor, and placental growth hormone. And the hypothesis was that the patients who exercise more will have lower level of this of the SFLT, that's the bad analyte that has high risk of preeclampsia. So you can see timeline is getting shorter. We submitted the request in January 2021, and within a month, we received the data set. Then we worked with our local statistician, and the medical student, Dr. Wharton, she had the poster at the 2022 annual meeting of the Society for Maternal and Fetal Medicine, and first author publication. She's now OBGYN resident at Washington University, St. Louis. And a current example, so this is Dr. Sanji. She's my postdoctoral fellow. I did the same. I gave her, said create a profile, get the code book, and tried to come up with ideas. And she came up by herself with this idea: predictors of vaginal delivery in the contemporary cohort of nulliparous patients. This time, it took 4 days to get the data sets. And so in 2023, we submitted it in August 25. Within 4 days, we had the data set already received. And she recently presented the poster at the Society for Reproductive Investigation in Canada. And currently the paper is in review with AJAC, American Journal of OBGYN. So what happens after we receive the data set? There are requests for annual reports where you can change your study team or change your business official person. And at the end of the 3 years, I think Dr. Rosen was mentioning, you can either continue to renew this agreement. You submit what you have done, kind of like with the NIH grants, what have been published, what has been done, and request renewal, or you terminate the contract, and you get emails pretty frequently reminding you, okay, you have 1 month, 2 months, 3 months left until the agreement is expiring. So to summarize what works well, and first of all, it's very easy to submit the request. And as you can see, very quick timeline from data request to data receipt. I love the fact that you can see code books of all these data sets and can come up with ideas using the code book. And also, it's really minimal effort required for access maintenance. We submitting these annual reports or every 3 years submitting update. What I think can be improved, I cannot see what are currently approved ideas or requests in progress. So I don't know if someone on the back end reviews and make sure there's no duplicates, because then it's going to be really hard to publish the same idea. Also, I was showing you at the beginning, we used the CSL data for 3 different research questions. So we had to submit the full kind of agreement every time for each different research question while we're working on the same data set. So I wonder if it can be done using one data use agreement for the same data set, and you can just add new research questions and keep prolonging the use of this agreement. And I think, as again was mentioned before, there's no access to long-term follow-up studies. For example, the new mom-to-be was funded by NICHD, but then there was heart health study, which is a follow-up of participants in the new mom-to-be funded by NHLBI, and there's no access to the follow-up data set. That's it. Thank you so much for your attention.
Thank you. So we're going to have a little bit of a discussion and definitely welcome questions from the audience for any of our panelists. I think one of the things that strikes me is that there's so much data, and the great thing about DASH is that it allows more people access to the data outside of the initial study. And so encouraging people all over the place to utilize these data, because they're very powerful. And as Dr. Palatnik said, there's big data. 200 some odd thousand people in labor across the country is a lot of people. And so really trying to figure out how we can get more use of these data and make them as user-friendly as possible is really important. I did want to, ask a question, and I don't know if this is more directed while everybody is thinking and stepping up to the microphones. Maybe towards Dr. Rosen a little bit more, but are there ways that NICHD has thought about to get more use of DASH? I know that and particularly, how can we, you talked about the ontology, but how can we harmonize some of the data elements so that potentially you could combine data from different large studies? And so I thought I would ask about that, and maybe Aaron will answer that too, in addition to Dr. Rosen.
Sure. Is my IT working? I'm having some connection issues, but can you hear me?
Yep, we can hear you and see you.
So this is the purpose of the code book. It is really difficult to go back and harmonize data if they weren't standardized at the point of collection.